Now, let's get to Elaine Mitchell's question, which is the question that everybody in the country is asking. Can Ebola spread by someone sneezing or coughing on you? Is this under control in the USA? And she says thanks in advance.
Okay. You're welcome in advance. And I will say that the CDC and again, all the experts say it is not spread by the air. Now, what that means is it's not finely aerosolized in a way that can significantly travel in the way that the influenza virus does. If it were able to be transmitted this way, there would be tens of millions of cases of Ebola every year.
In West Africa.
In West Africa.
Because it would have spread much further, much faster.
So that's the bottom. You can have theory and this theory and that theory, but the bottom line is we would be seeing millions and millions of cases. In the United States, every year, 5 to 20% of people get influenza. So we're talking about, I'll do the fast math, 15 to 60 million people who get the flu every year. So the fact is that it has not been spread that way in West Africa. It hasn't been spread that way in previous epidemics, which, by the way, are a couple of dozen over 40 years since 1976 when it was first discovered. So there's no reason to think that this virus is acting differently. It's just that it's spread more widely.
And the way that it is spread, what we do know about that is what?
Direct contact with body fluids. And that's been shown time and time again. And that means, you know, nitty gritty, vomit, stool, diarrhea, sweat, and also possibly semen, sputum. So anything that could get into an open wound or something in mucous membranes. So if it splashes into your mouth, in your nose, in your eyes. So unless somebody, I asked the CDC about this quote, what if somebody sneezes right into your face and the fluid goes right into your mouth? And the representative from the CDC said, when was the last time somebody sneezed right into your face? Of course, I said that and then somebody tweeted, yesterday at Walmart. So, you know, I guess.
So possible, but not likely in that particular illustration.
I think the truth is that that is not a way that is in any kind of significant way, you know, Dr. Frieden said never say never. If somebody, I suppose, had fluid that had the virus in it and somehow got it directly into your mouth, nose, or eyes, yes, theoretically that could spread it, but that is not the way it is spread in this epidemic or in others.
And patients are not contagious, as I understand it, until they have symptoms.
That's so important, and we cannot say that enough, because in the flu, you can spread it the day before you get symptoms, and that's one of the insidious things. So out it goes, and you never knew you were sick. In this case, if you don't have symptoms, you cannot spread it.
John, thank you very much. Dr. John LaPook, who is our resident authority on Ebola, Manuel Bajorquez in Dallas, covering the developing events there. And thank you, one and all, for joining us right here for our conversation about Ebola on CBSNews.com. There'll be much more on this story later tonight on your CBS station. We'll have the latest information right here on CBSNews.com, and you can count on more reporting tomorrow on CBS This Morning and right here at the CBS Evening News. Until then, I'm Scott Pelley, CBS News in New York.